Yeah.
Hello. Happy Friday. Sorry, I hit go just a moment
I was trying to get something out. I was like, that's one. Stop.
Yeah. So, yeah, it's hilarious. Welcome, Dr. MaryAnn Wilbur. How are you?
I'm fine, thanks. How are you?
It's a Friday and we're doing a show. So what the hell do I have to complain about? Yeah. This is all, it's pretty much like the best part of my week right here. Like talking
this
to
is
people.
something Matt and I are trying to do full time.
Yeah, I would love to. So, MaryAnn, where are you at again, geographically?
At the moment, I am on Sanibel Island in Florida.
Ooh, look at you. You going shelling?
I could go shelling, but I just happen to be working with a wonderful view out the window.
Oh, perfect.
That's awesome.
So I have family down here. And so, yeah, I'm in a little island in the Gulf of Mexico right now.
You know what I love since COVID is like, you used to be like, oh, where are you at geographically? Boston, Chicago, Topeka, whatever. Right now almost everyone's like, well, right now, today, presently.
I like dramatically. Yeah. When I went from surgeon to social justice warrior, it's a much more remote vocation.
Yeah, for sure.
Well, Doc, you teed it up.
Yeah,
Take us through the journey.
Yeah. What happened?
Go with it. How did it all start?
Oh my, where'd you start? I have actually started telling people that there is a disclaimer to hearing my story, and that is that I'm from America, but I'm one of those Americans who was born into poverty. That does shape how I see everything. So it's worth knowing that that's going to be my perspective. So I was born to teenage parents, and we were living in a trailer park just outside Camp Lejeune. They had been on base housing, but I think my dad was into some shenanigans that got us kicked off. So,
no.
So that's where I started life. And it definitely colors how you see things growing up. And so growing up, it was a big Irish Catholic family. And so there were children everywhere. But higher education was not common, and particularly not in women. And so those were my early experiences, but I wanted a different path. And so we'll sort of go through it quick, but I had to work through undergrad and then started medical school when I was 27, so a little older than average, but not terribly. And
when do people normally start med school?
Most people are in their early 20s.
Is it like right from college to med school? Yeah.
Most people will do a 4-year bachelor's and then go right into medical school.
Okay, gotcha.
So they're like 21. Maybe
yeah. So a little bit younger. Gotcha. Okay.
And then some even do a 7-year med program where they do a 3-year bachelor's and
combined program. Yeah.
So, just like do it, streamline it. So I had some classmates who were actually 20 and turned 21 in medical school.
Wow.
And even though it's only a few years, the difference between 20 and 27 is significant in terms of life experience, especially depending on what your life experience was. So, so I went to medical school, and then it was very clear to me early on that we were not going to be talking about the social determinants of health, which to me seems so obvious, because if you grow up in poverty, you just you look around and you see these things. Like, obviously poverty matters. Clear, like, how are we not going to talk about this? So that was a really important part of the education that was not part of the curriculum. And that is, who writes the curriculum and who the system was designed to serve is critical to who the system serves and who gets served and how. So, I was sort of disenchanted early and ended up adding 2 public health degrees to my studies because I really wanted to understand a lot of the things that we weren't going to talk about. I realized medical school, for better or for worse, was very focused on the patient in front of you, one-on-one, but not really taken in context of, how does society impact, this person's social standing, their ability to, combat whatever it is that ails them, things like that. So I was disenchanted early, and it never really improved, honestly. As my experiences grew, I just saw more and more of that same, indignity, really, for, anybody who was socioeconomically disadvantaged and then disadvantaged in terms of human hierarchies, which strongly correlate with economics. And so I sort of did the best I could through all my training to, take the lesson, help out wherever I can, try not to get bitter. But I was always sort of struggling this frustration, thinking, once I'm out, then I'll get to choose how patients are treated, because I won't be sort of under somebody else's thumb. I'll be able to determine. And I realized, that's not how this works, and not in the current system. So I was extraordinarily well trained, actually. I loved medical school. And I went to BU, and then I matched at Hopkins. So I did an OBGYN residency at Hopkins, and then I did an editorial fellowship with New England Journal of Medicine back home in Boston. And then I went back to Hopkins and I did a GYN oncology fellowship. My first public health degree was in Boston at BU, and then my second public health degree was at Bloomberg, Hopkins. I did, in the end, 4 years of residency, 4 years of fellowship, and then 4 years as an attending. And then I couldn't do it anymore.
Wow.
It's a lot of investment, time and money wise, to be like, no, fuck this.
You know what?
It's a lot.
I know, let that sink in.
Well, Matt and I have said this various ways, right? We have a lot of discussions around like longevity and lifespan and the fucking term biohacking. Yeah. And I think Matt put it the most succinct, which is you can live forever if you have enough money.
Yeah.
And inversely, the other thing happens where, like, the less money you have, the less likely you are to even be healthy.
Yeah. Oh, yeah. Oh, by a lot.
Yeah. Yeah.
And it's not like this is not understood. Public Health 101, your zip code determines your longevity and the quality of life you live. And so there are plenty of places, Baltimore's one of them, where 2 zip codes go back to back.
Yeah,
because you've got
block
really
to block.
Yeah,
I mean, forget about.
So right there, you've got that area of I'm going to get myself disoriented, but that side of MLK that goes a little bit north, and then about Towson, and you've got these 2 neighborhoods back to back. The expected, the life expectancy across this like street is 20 years in difference. It's 19.6 years on average.
Yeah, that's bananas.
That's insanity. Yeah.
That is crazy. And this happens actually across the nation. There's another spot where they're back to back in Virginia, up in Rochester, New York, Rochester abutting, I think it's Webster, does the same thing. So it's not like Baltimore is the only. The fact is, in our country, we allow for these kinds of disparities, and they're reinforced because we have this idea about American meritocracy as if. And I get really bent out of shape sometimes when people point to me as, this like unicorn of American meritocracy. No, I was just super effing lucky. Fact is, I was born white, healthy, without significant mental illness. I was kind of cute. I was cisgendered, hetero, like things, and then somehow miraculously didn't get pregnant, which was the prediction of my entire family because,
sure,
that's what teenage girls do.
That's the template, right?
And then you don't educate them because it's just a waste of time.
Yeah.
So, so these sorts of things get reinforced, and then how we fund our school systems, based on local tax, it just reinforces the system so that if you're down, the system is made to keep you down.
So let me just ask a possibly devil's advocate question, but just to push back on you a little tiny bit on that comment. People say you're the unicorn. That's a lazy argument. I get that, but like I don't know that it was luck that got you there. Honestly, you sound like a driven, organized.
Yeah, like you had to pull harder than mere Matt by appearance alone.
Right. And like, listen, honestly, I've heard this argument. You're not the only one who's in this camp, right? There's a lot of people that are cisgendered, white, there's a bunch of things that people, they're or black and gay and, all kinds of things where you take wherever they're at. And if it's in a place of advantage, then there's all these justifications. Well, you were lucky, you were white, you were rich, you were this, you were that, or you weren't those things. You're at the bottom end, and it's because you're black or you're whatever. And I was like, you know what? The common thread between most people I know that are not at the bottom end of that spectrum, it's that they're fucking workaholics. Like they don't stop. Like yes, some of them are white, but some of them aren't. Some of them are gay. Some of them are Republican. Some of them are Democrat. The only common thread that I see in them is really this fact that they're workaholics. They're just
I think Matt means that as a compliment, Doc.
No, it's a compliment.
Mindful not to be anymore. But I think actually what my kindergarten teacher said about me was really, really important. And note this because she used a word that's not even a word, give you a sense of the school system I was in. But she said, MaryAnn has a very strong stick-to-itiveness.
Mm-hmm. Yeah.
And I'm just going to keep fucking going.
Right. So like, that's not luck, MaryAnn. That's like you being stubborn. But it's part of it.
Now I want to ask MaryAnn, we had a cardologist on last night.
Yeah.
And now I want to know your date of birth to pick whatever playing card you are and read about that, because apparently Matt and I have the right cards for us.
Yeah, we're yeah. And by the way, I my whole family picked cards last night, and it's like, I got to tell you that thing didn't get less accurate. Like I was like,
it was so weird. It was so weird. And
like, like I just get bothered when people are like, "Oh, you're a unicorn" or whatever. Not because that's not possibly also true. But
it's not like you stumbled into an MCAT exam and just crushed it.
Right.
It's like,
like what do they say? Luck favors the prepared, right? Like, so it's like, okay, so you got a woman who's like been prepared her whole fucking life and like didn't want to be pregnant and barefoot at 17, right? Like that's not an accident, though. You know what I mean? That's not a unicorn status.
Yes. I'm downplaying my own efforts.
Yeah.
But,
so that's fair.
I guess what I'm saying is I'm not extraordinary, except that I work hard.
Yeah, but percentage-wise, that does make you extraordinary. Believe me, I know plenty of people that have gotten by on family laurels or something.
Oh yeah. Yeah, like luck and unicornness, I think are really what Tom's talking about. The lucky sperm club, like the people that are just like, like I walked into the Rofo and bought a lottery ticket and won $1 billion.
Yeah,
like that's truly lucky unicorn status. Everyone else,
I say born on third base, and the most frustrating thing is when somebody's born on third base and they just refuse to recognize it.
Right.
Like,
well, that's also
yeah. Well, believe me, there's plenty of that.
Yeah, it's also predictable, right? Like you almost could tell walking in the room, those people, you're like, I know where it's coming here. Like this is not, So anyway, like I said, I guess I wanted to tip a hat to like, look, people don't get where you're at by accident. It's hard as shit. Like, and if you gave up at any one of those inflection moments, you're like, you know what? This is not worth the fucking fight. Like you could have been like,
I think it's worth saying. I am resilient as a motherfucker.
Yeah,
I really am.
All right, she gets the show, Matt. She gets the show. Yeah, she just said motherfuckers.
Let's do it.
We get everybody on the ride eventually.
One of the things that gets me really, really, angry in the current situation is it's not just patients who are being, underserved here. It's my colleagues, people who really, really care about patients and want to do the right thing, and they are getting shit.
And they're punished almost. Yeah.
Oh, very much so. Like actually sought out. If you don't toe the line and make the profits, you will be harassed.
Right.
It is getting really, really ugly. And then when you, push back and say, this is, if you even say this is exhausting, they're like, well, you need to be more resilient.
Right.
Dude, I am the most fucking resilient person you will ever meet. I went from trailer park to academics, Ivy League, and, and now I'm back again by choice in the gutter, trying to make things better. I'm plenty resilient.
Yeah.
Not that doesn't jive.
But you know what? I think this is a reflection on the world at large. I just read an article this week about the rise and fall of Panera, right? I know it's nothing healthcare related.
No, we lost Panera.
But here's what happened. A guy who cared a lot about A guy who cared a lot about
what will we do on Sunday mornings?
Yeah, what will we do? To pay $28 for a sandwich. Yeah, no, it's cool. No, but here you got a guy who cared a lot about food, and he makes a place where they make great food. And then he sold it for a lot of money, which is what you do as a business owner. And then the private equity firm fucking systemically broke it down to nothing, right? Yep. And now they lost confidence, brand, and everything. But it comes down to ultimately the same problem that you have in healthcare. It's like these companies optimize to the margins, not the people, right? And so once you do that, it's no longer the same business. It's a different thing. Now we can qualify this all day long, good, bad, or indifferent. But the reality is it's at a core, just a different business. Yeah. Right. And so
a different business that is not regulated.
Yeah.
Well, it's not just not right. I mean, yes. And I mean, it's not just not regulated, but it's like, it's only about money. So therefore no human centric decisions could even be made. It's not even part of the parlance of that, of that world. Like, you know, like, and that's where I think this movie is interesting. I know we said we're going to talk about it towards the end, but this movie got our attention, Tom and I's, because we've had hundreds of people on this show.
Yeah.
And they all kind of say the same shit in different ways.
But even the ones that you could give empirical evidence to how they're wrong with certain medical opinions, they are probably as loud as you are as an advocate for like, hey, this system is fucked. Yeah. Right. So you can almost understand some of the, well, I'm not getting the jab. Why? Because that whole system is about money. No, I'm 100% right there.
Right.
The virus doesn't give a shit. You know, like, no, but they're all out to get us. You're right. But
yeah, you are also correct.
But
healthcare institutions, they don't, the high level decision makers, they don't care about patient outcomes any more than the new owners of Panera care about small farmers.
Well, yeah.
And that's what I'm saying. I think globally at every level, that's where we're at. And it's funny, Tom, it's officially 17 minutes before we say AI. Here it comes.
Okay. All right, here we go.
Yeah, right. MaryAnn, we need a buzzer for AI because it's coming up like all the time.
They gave us a year in review on this platform.
Okay.
And it said your most common word. And it was 5 minutes of us and guests saying AI.
Yeah. It's just so funny. But like one of the crises that we're going to see get worse before it gets better is AI force multiplies that equation. Yeah. Right. So now, what's his name? Jack Dorsey's company that he's doing right now, just read yesterday, they're laying off 4,000 people. And he didn't even pull punches. Why? AI.
We don't need them anymore. Yeah.
AI has, and his point was right. AI has fundamentally changed the physics of what it means to run a business in 2026. It's totally different. But you know what that also says parenthetically? Well, actually not even so parenthetically, but it says we don't give a fuck about the people that like, this isn't about the people anymore.
Yeah.
And that might be okay for Jack's current company or Panera, right? But Panera, I mean, again, not healthcare, but Panera, they lost $400 million in market share because of this. That is not recoverable. Like so the consumers voted with their wallet. We just haven't gotten there with healthcare, but I'd love to hear how it seems like you might have an idea here. How do we get into that sort of Panera moment where customers like, you know what, fuck it. We're just not giving you money.
Couple dozen Luigis.
Yeah, right.
Because you're no longer honoring the deal. The deal was, at least in the early days of Panera, was, all right, I'll overpay, but I'm overpaying for quality. And somebody who, now I'm just overpaying. I'm done doing that. And that is an important distinction because that is actually capitalism at work. That is an informed consumer who is voting with their feet.
Sure.
That's not. When people push and they say, yeah, well, we're not going to be like Norway, when we plan our healthcare system because we're different. We're American. We like capitalism.
We like being fat and sick.
Yeah.
Fuck you. It's freedom.
Yeah.
What we have in U.S. healthcare right now, that's not capitalism because I can't make the decision about where I seek my care. right? I don't get to choose my health insurance. If I'm employed, I get maybe 2 options, right? And then they tell me what is in network, and they don't even tell me there's no transparency in pricing. There's up pricing based on insurance that I didn't. So this whole thing is rigged. That is not capitalism. That is the opposite of capitalism.
Oh, you're so close. You're so close. I'm going to send you a book by an old German guy named Karl Marx.
Yeah.
It's a thick book.
Okay, if we want to keep it capitalized, I'm not even going to push, because I do think it's very, very important for us to honor American ideals when we make decisions about how we redesign this system. So I'm okay with capitalism, but one, capitalism is regulated in this country. Okay, monopolies aren't allowed. We have antitrust regulation for every other business except for healthcare, because it was carved out by a couple of very unscrupulous individuals who worked at the IRS, who later got jobs and died healthy and fat in the same companies they were supposed to be regulating.
Which makes total sense.
Never got fixed.
Sounds super American.
That sounds like proto-America right there. You're like,
because there's no transparency. Consumers are not allowed to make the choices, and it's not regulated with antitrust regulation. So that's not true capitalism. That's just a monopoly. So,
yeah, and I also get a little pressy when people start saying things like Norway, not you, but people like in this conversation, oh, it's better over here. I'm like, no, it's not. I've been to all those places. And you know what? Those systems are sucky in whole different ways than ours.
In different ways.
Yeah, like, so it's not
perfect. It's important that we all just say it now. There's no perfect system.
Yeah.
No, it's not. But I mean, I think perfect example, I'm on a Maryland Innovation Council. I do some work with them. A lot of startups, a lot of people not from the US, right? That they're moving their companies over here. And a lot of the people I work with have established companies in another country, and they're in a bridge program to kind of come here and start an American version. Do you know what is universal? Everyone doesn't have any idea how or why we have pharma commercials on TV. It's like the number one thing that everybody from somewhere else recognizes immediately. They're
Farming
like,
is in agriculture or farmers insurance? Pharma. Oh, don't even get me started.
I want to get you started. That's why we had you on the show.
That's the point. It's called Irreverent Health for a reason.
Yeah.
It's dangerous, and it's a big part of where the money goes that is just the overcharging just gets pushed right back onto the consumer.
And we don't have cable. We Hulu, Netflix, etc.
Yeah.
I can't tell
you
every
fucking commercial. Every commercial.
Super Bowl, I'm like, those seconds are very expensive.
Oh yeah.
And there were a lot of pharmaceutical commercials on the Super Bowl this year.
Well, at $30 million for 30 seconds, when you count production costs or whatever the numbers are at, it's like, who the fuck can afford that? It's certainly not, anybody.
And who's paying for it? Really, it's you and me, because when we need those medications, we overpay. And we got screwed the first time too, because the pharmaceutical companies historically have gotten most of their grants to make these drugs. So they take taxpayer dollars to create the special drugs for Americans, and then they keep the money to themselves, and then they overmarket them, and then they put that cost back on us too. So we get doubly screwed, just in that two obvious ways, and then more so. It's just, the whole thing is really become, it's all profit driven. And I feel like I'm very doomsday right now, because it doesn't have to be this way. Only a few people benefiting, but the status quo is very powerful right now, and it's harming people.
But I think that's where I was going. I think that we're kind of, Panera is sort of the canary in the coal mine for me, because it's
Panera is your med star.
Well, it is, because first of all, Panera is not the first company in recent times that this has happened with, and so
even Target, Target.
Look at Target. I mean, the world was theirs to lose, and they're just handing it away.
And they're like, yeah, we're not going to put up the pride flag, and everyone's like, okay, fuck you.
Right.
It's great.
But here's the thing, like, that took a thing, right? It took them what was the catalyst for them? They took out their DEI policy.
The DEI, they lost DEI, and this is the same reason you see Costco flourishing while Sam's Club and BJ's are taking a dump. You know,
the thing is like,
it's kind of crazy. It's like, dude, just know your audience.
Yeah, like that's exactly like who? Oh, you think it's a bunch of rich white dudes? Is that who you're selling to at a box store? You think the billionaires are going? Actually, we did meet a really rich dude that shops at Sam's Club, or no, Costco. It was Costco. Motherfucker.
He eats entirely. His whole diet comes from fucking Costco. I love it. I'm like, this is
organic yams and wild caught salmon, and all from Costco,
down to the dollar how much they cost, which was even better. Like
he was basically telling you how to get healthy for like $50 a month.
Yeah. Right. But here's the thing, like you have a company like Target who has a bougie name crafted around it, Target, right? Like, I mean, that didn't happen because people felt casually about Target. Like that was like people were invested.
Oh my God, Target. Man. That was like, what movie was Old School, where they're like, he's like, oh, what are you going to do tomorrow? Right. And he's like, oh, we're going to go here. We're going to go there. And that was Target for me and my wife. It's like, we don't fucking need anything, but we're going to go walk around Target. Why? We know exactly what's there.
Sure.
But sometimes there's something new.
Don't know time.
But you know what? Here's the funny listen, DEI was very expensive for companies like Target. I can only imagine to implement, to maintain, to police. That's got to be a huge pain in the ass. But look at the people who name your store some bougie ass name like Target. Like they need all of that. So like,
well, not only that, those are the people that care about those things.
Well, that's exactly my point.
Yeah,
right? And you just spit in their face. Medical can do this all day. No one gives a shit. But so, MaryAnn, my question really is,
well, because they kind of have all the chips,
Well, that was my question. Is it because people don't think that they have the same consumer power around Target as they do with their doctor? Is that like?
It's not that they don't think, they don't. Because the way the networks are set up is patients don't have the power to choose. They have to choose someone in network, and it's getting harder and harder because physician shortage is getting worse and worse. So it's all like this has been growing. This problem has been growing for the last several decades, but it's now it's come to a tipping point because we can't anymore. But it's not just in the imagination of patients. Mm-hmm. What we're calling in this case consumers, since we're like comparing
patients.
Because that's how you're treated. Yeah.
But, they literally cannot make choices, it's not just in their heads, right? So, for example, my son has an autoimmune condition. He needed an endoscopy, and the insurance company wouldn't pay for it because even though we were down here and they knew I was down here and working remotely, they were like, it's out of network, blah, blah, blah. So I fight the out of network thing. Then they're like, no, he had an endoscopy last year. So this is elective. And I was like, I know, except he's having new symptoms on the new treatment. So it's not elective. And by the way, I hope you call the authorities, because if you think that I'm bringing a 6-year-old child to be anesthetized,
right. That's abuse. Yeah.
That would be abuse. So if you think we're doing this for funsies, I hope you call the authorities, and even that, they were like, we'll pay for half of it. And I was like, where, I don't understand. So then I go to the hospital and they're like, well, it's going to be $4,000. And I was like, it's ketamine and a colonoscopy. Like, what are you talking about? $4,000. And they're like, oh, well, kids can't be in the outpatient surgery center. So it has to be the full anesthesia, blah, blah, And then I realized if we were paying cash, it would have only been $1,200. And there I would
fuck you. Oh.
Yeah.
So the whole thing is rigged, but I don't have the power to go outside of any other system. So it's not invented. Like, it's real.
Well, actually, you get to the point where the insurance company wants you, because if you just
you're paying out of pocket and they're not losing anything.
Right.
No, everybody won. I gave Blue Cross Blue Shield $30,000 last year. They paid for almost nothing. Oh, and I paid double for my medications until I realized that if I just pay cash price and don't pay through insurance, I actually pay less.
Yeah.
And actually a step further than that, if you bought your prescriptions in cash at Costco, it's like $10. Right. It's like, and that is, I don't know how they, I don't know how the unit economics work for those box stores like that, because that doesn't make any sense.
Well, what we're getting at here is, so it's not in their heads that patients really are powerless. And it's important to understand that there are very few people who are actually really making bank on this. So like resources really, and it's important to say there's more than enough money. $5.3 trillion last year. That's more than enough money to take care of everybody. But 70% of that is siphoned off for greed, administrative nonsense, marketing, all those things, right? So if you only have about 1/3 of that money left, that's being used for the actual patient care. Patient care is now being delivered in a low resource setting. So that's how we end up in these sorts of situations, and it's not in the patient's head. So then they get frustrated and they're like, what the fuck? Why can't I access? I had good insurance, right? I'm a physician. I speak English. I have good insurance. I should be able to
navigate the system effectively. Yeah.
If anybody had a chance of navigating it, it would be me.
Yeah, I was just to say, if not you, who the fuck can?
Right, exactly. So it's not in our heads. We really can't get what we need anymore. So what you would think as Americans, we'd be like, okay, well, we'll fix this, right? How do we fix it? Since we know only a few people are making bank, right? And then there's an upper echelon in like hospitals and stuff where like they're getting a solid take. Like the status quo is serving them. They're not going to upset the apple cart. So there's a few people making bank. There's a few more in this upper echelon of like, yeah, it's not that bad. I mean, I'm making decent salary. And then, there's like 99% of us who are just like, what the fuck? The patients and the people who are on the ground trying to care for patients. So all of us, 99%, you would think like, what are we going to do? Here's the problem. We are stuck because, and I know this is going to sound crazy, because we need campaign finance reform in this country.
MZ was on our show. You guys know him.
You've been on his show. Yeah, we're all mutual buds now.
This is why it's important, and because it takes a little while to get there. Because you're like, wait, what? How did we just go straight to politics? Hear me out. So, if something is wrong in America, what we do, right, is we talk to our legislators and we try to make change. But in our country, our legislators are allowed to be openly bribed by all of these companies. And that is because of something called Citizens United. So in 2010, Citizens United was put before the Supreme Court. And there were two questions. One was, is giving $1 the same as freedom of speech? Two, is a group of people the same as a person? The Supreme Court was 5-4 on it. In favor of, yes, $1 is the same as freedom of speech. And two, yes, a group of people is the same as a person. Ergo, a corporation can give money and it is protected behavior under freedom of speech in the First Amendment. Now, if you look at the dissent, it is clairvoyant. Basically, what the dissenting judges said was, mark our words, this will turn our democracy into an oligarchy. And that is exactly what has happened.
So let's say allegedly Luigi did kill that CEO. Could allegedly he then go kill everyone else at United Healthcare and only go up for one murder because he took out a corporation, not a group of people?
I am not prepared to answer that question.
But
I have dreams.
Tom's point, and here's where Tom's point is funny, but also dead on accurate, is like no one ever thinks these things is clearly out as they should, because if you are going to make one person the same as a group, then Tom's view is perfectly legitimate.
Not mass murder, it's one murder.
Yeah, no, I didn't mass murder anybody. I just took out a group.
I took out a corporation, which is one person, according to you.
Right. But that's never going to happen, obviously, if Tom went in there and Uzi'd everybody. I mean,
I wouldn't Uzi. Look, I took genetics.
Yeah. Like, if if Tom made it out of that, you're right. It's just it is so absurd when you look at it through that, because obviously that's not going to happen, right? If Tom did go in and Uzi everyone, he would be brought up on 24 counts, not one. Like, we all know that. So like, why does it work one way and not the other?
Because the Supreme Court got it wrong this time. That's
well. No, let's play this out real quick. Go the other way though. Like, not the other way, but let's question that thing. Is it not fair to say giving $1 is freedom of speech? Because dollars are what propels people to do anything. And if I want to support you or Tom or anybody else, and by giving you guys money, that
up until that point, I could donate to a campaign for, somebody who's coming up for Congress. Like, I have a friend who's running for Congress and I think she's awesome. Her name is Tina Shaw. She's running for Congress in New Jersey. And so I gave, some money to, and that was allowed. That was allowed before Citizens United. Citizens United changed because they allowed big money to donate.
Which in a lot of ways they were bribing under the table. They were doing these things before. They just threw it out in public. Yeah.
Right. So now big money, whether it's NRA or Big Pharma or AHA, the American Hospital Association, all of these big money interests, literally they give to everyone. They give roughly the same money to everybody. So they line everybody's pockets so that everything stays the same. It maintains the status quo.
So then if that's the underpinnings of that, how do you get through that? Or how do you, work that system? How do you get out of it?
Is there a way out of it? To reach 10 million voters, because a movement requires 3.5% of the voter system. And we have 344 million Americans.
Okay.
So you reach 10 million people, make sure they understand this, empower them, and you make change.
But what's empowerment mean in this lens?
In this case, and it doesn't matter what side of the aisle you're on, I think everybody can agree healthcare is broken and big money should not be running our country. The legislators our representatives should be worried about who is putting them in office, not who's lining their pockets. And even the legislators don't like this anymore.
Well, I mean, I would say that those big corporations are the ones putting them in office.
Yeah,
right.
Sure.
They're funding the majority of their campaigns. They're giving them money to, before they can even vote, In
a democracy, our representatives are supposed to be beholden to the voter.
They should be scared of us.
The democracy is. But we don't have a democracy anymore because our representatives are beholden to big money. We need to change that. We need to put it back.
Yeah, and I think that again, because we're optimizing to margins, not humans, I think that this is just becoming, that signal is getting lost in the noise of just 2026.
Because only once that happens can we put in legislation for things like physician autonomy. So for example, if you're in a plane and the pilot says, no, this isn't safe. This plane is not going to take off. If say I'm a pilot and I work for Southwest and there are, 250 people on this plane and I'm like, nope, this is not safe. We're not taking off. This plane is grounded. Even if Southwest is like, dude, we'll hold your paycheck. A pilot has federal autonomy to say, no, this is unsafe. But as a surgeon, I was working for a hospital and I was told, you will do this surgery. And I say, no, that's not the correct surgery for the patient. And they say, we control your paycheck. And I say, fuck. Because I have no autonomy, nothing that supports my ability to say no.
And what does that back into? A risk equation?
All kinds of things. That plays out in different ways. So for a surgeon, it may be I'm pressured to do the wrong type of surgery. And in some of the pressure is subtle in the beginning, but if you don't toe the line, the pressure becomes more intense.
I had an Uber driver we talked about a little while ago on the show. What was that, Tom? About 6 months ago, maybe? And
we had an Uber driver as a guest?
No. We had an Uber driver on the way home from one of our third Thursday things here. And I was talking to him And, you know, I was coming home to record the show, and I was like kind of in a rush because we were running. And the guy said, you know, oh, you record a show. What's the show? And I said, Irreverent Health. And he literally whipped his head around and was like, you talk about health? And I was like, yeah, why? What's up? He goes, tomorrow morning at 9 a.m., I have a bankruptcy hearing because I'm going bankrupt. He goes, I moved to this country.
Number one cause of bankruptcy in this country.
27 years, I think he said he'd been here. He said, I immigrated here from India. I started a cab, you know, ran a cab, whatever. He said, I put 2 daughters through med school in the United States. I own my house outright. He goes, all these things. Well, here's where it goes fucked up. His wife was having a cancer removal surgery, and she's on the table. And surgeon opens her up and finds out that there's a whole nother tumor that they didn't see. And, and he's like, look, I got this lady open on the table. Like, now's the time to take it out. He has his assistant, and whatever they're called, you know better than I do, but whoever can dial the phone, he literally calls United Healthcare from the OR.
Which he should not have to do. Which
you should not have to do, because he knew exactly what you just said. If I cut this lady open, she's already open. If I take this tumor out, there's no fucking way they're going to approve this. And then who's paying for this, right? So he's sitting there in the worst possible situation ever, I would imagine.
She's already open. The right thing is to do the right surgery.
Correct.
You should not ask some businessman for the, you know.
And you know what the person from United Healthcare told him? You have to file the paperwork so we can get an approval before you can do anything. He goes, this woman might not make the next surgery.
Right.
Why the fuck would we leave this tumor in her?
Clinically, that is the wrong decision. You don't take people back multiple times. The risk of anesthesia and ventilation and, you know, gets higher and higher when you put these surgeries back to back.
Well, I'm sure all of those things are going through his head. So what did he do? He did the surgery anyway, because that was the right thing to do. And this poor fucking guy is having to file bankruptcy.
Yep.
And I'm like sitting there going.
And the surgeon knows, because the surgeon's like, damn it, I want to do the right thing for my patient. I just put a family in bankruptcy.
Sure.
And I'm taught primum non nocere. First, do no harm. I just harmed that patient, and you fucking made me.
Right. Yeah. You
get off.
Yeah. Right. And that story is absolutely bonkers. But you've heard this a million times. My wife needed an MRI, and I don't know, there was an order of operations. It was a covered MRI, but because she called on the wrong day, or Mercury was in retrograde, or some fucking stupid, they were like, no, we would totally approve that.
My kid's 6-year molars came in after his 7th birthday. They didn't cover the sealant. I was like, thank you for the laugh. I just can't.
But so you see this in all levels of it, and it's like, it's kind of like, well, wait a minute. You would, like, this woman, my wife, like your son, like, these are approved things under most circumstances. The fact that you're finding some semantic loophole,
not only, like, you're not asking for something weird. This is pretty fucking routine. It's not like, hey, I want to do this experimental, explorative thing, you know.
Despite he's not, you know, there's blood coming out of his rectum and he's not growing, despite the treatment that we thought was going to work. So some shit is wrong.
Something ain't right.
Check it out.
Yeah. Yeah. And honestly, like, it sucks. We actually learned very hard way last year that my wife's insurance that we're under at the moment does not cover a bunch of things that, you know, I think should be. Most of it is out of network type stuff. But to your point, finding somebody who's competent in network is getting hard.
Yeah.
And so we just paid everything out of pocket. But I'm kind of like going, well, wait a minute. If we did the year in review, and knock on wood, nobody had like some catastrophic thing, which insurance would be much better for. But like,
allegedly,
we paid 90% of this out of our pocket anyway. What the fuck good?
All right, you want to hear something crazy? I'm going to admit this on public, but you know what? Since we're talking about the movie, I am currently uninsured. I have no health insurance, and it's somewhat by choice.
Right.
Because last year I paid Blue Cross Blue Shield $30,000 and got virtually nothing.
Yeah. So what's the point?
Right. So my kids and I really did actually go bankrupt, going from surgeon to social justice warrior. So I actually went through bankruptcy between AJ's condition and a hurricane that I that I survived down here in Florida. So I went bankrupt. The only reason I was even keeping insurance was if there were a catastrophic injury, then I, wouldn't go bankrupt. Well, I was like, fuck it. I just went bankrupt.
What? So how's that protecting me? Yeah.
Now I get cash prices when I go to see my primary care. I pay cash prices for my drugs, which are a whole lot less. And when I need a procedure, I pay cash prices because I get the cash prices, which are basically like 1/4 of what they were going to be charging me when I was out of network Blue Cross Blue Shield. So I'm paying way less, getting better care. And if I get hit by a Mack truck, fuck it. I already went bankrupt anyway.
Yeah, I mean that's the only that's the roll of the die, right? Like that's the part where you're like,
I remember talking to somebody whose kid developed something, and I was saying like, "What the fuck are we paying for insurance for?" And he goes, "Look, they covered $400,000 worth of stuff."
My kids are both insured. Yeah. They actually have to be according to the family court.
Yeah. And we're playing, like, I'll be honest here, we're playing the in this state, a married couple can make a certain amount.
Mm-hmm.
And anything under that covers from Medicaid.
Yeah.
And that's kind of how we're doing it. It's like, well, we're not close as a couple to that upper limit. So no, they're getting Medicaid. And when they look at it and they're like, you guys are educated. You guys, why? Because I'm not giving fucking Blue Cross $2,000 a month to have a $13,000 deductible.
No. So I'm uninsured. The kids are on Medicaid. Yep.
Yeah. And it like at the end of the day, like that's still at least that there's some utility there, but like, unless it's extreme, I don't know that the utility is worth it, right? Like it doesn't
shouldn't be the answer.
No, it shouldn't be the answer. No. But like to your point, if you fell down a flight of stairs and broke your neck and 2 arms, a leg, and you probably want insurance in that situation, right?
Well, I'll get the care I need because they have to do it.
They have to do it. Yeah.
Right.
So I'm still going to get the care.
Right. Now, can you not pay cash even if you have insurance? I actually never seen.
No, you can't.
Really?
Legally, the provider is in a contract with the insurance company.
Really?
So does it happen? Depending on the practitioner, but not at a hospital.
This hospital had a contract with the insurance company. They were banking on making so much on that. I can't be because now I'm essentially the third party. I can't make them break their contract.
So is that the answer to the question? Like, does everybody cancel their health insurance? Does 10 million people cancel their health insurance?
Walked away from their health insurance, yeah.
And went cash.
Yep.
Like, is that the way you move this needle? I mean,
that would actually work, but it would be a pretty ugly revolution.
Well, ugly for who? I mean, I guess, it
would be very disruptive for a little while, but it would work.
I mean, listen, I bitch and moan about, I had last year 2 MRIs for stuff that were not elective per se. I had an issue, but I wanted them done more than I needed them ddone.
Yeah.
And what's an MRI? Like $800 or something? I paid $800 because my deductible is like 10 grand. So like all year, I mean, it wasn't 30 grand like you, MaryAnn, but I mean, I gave doctors a lot of fucking money last year, and I kind of like, well, like, what did I don't like, this isn't helping. Like, this insurance did nothing.
It's important to recognize. So the health insurance companies, so let's just say United had more money and revenue last year than Apple.
Yeah. Right.
Let that sink in.
Right. And they got crazy. Dropped by Hopkins. And they're still raking in that kind of money.
How they make their money is they take premiums and don't pay out. That's what the revenue is.
Right.
More revenue than Apple.
That is quite frankly startling.
Insurance company.
And at least with Apple, you get a fucking iPhone.
That's not Cigna, Humana, Blue Cross Blue Shield, like Aetna. You can keep going.
Yeah, but United is the 800-pound gorilla.
They're the big ones.
Yeah.
They're the big, but there are plenty of other, like.
Yeah, Blue Cross Blue Shield is no slouch either.
They're all the same now.
Right. And that actually, by the way, that United getting dropped by Hopkins, the Uber driver's wife was at Hopkins during that transition. And so like that didn't make things less complicated.
I think, Matt, and it's funny because you would think that people would be like, well, my my doctors are deciding not to take, in the public view. I was worried that there was going to be a perception like Hopkins is the bad guy in this, right? They're a big institution. No, everyone's like, fuck United Healthcare.
Yeah.
Right. So I think, and what I'm hoping, I'm praying for, that this is actually like a change in the tide.
That's
like enough people are aware. No, you guys are the bastards.
Yeah. Because, Hopkins is doing okay. Take a little off.
They've got a little college.
Yeah. They provide quite a good service. It's fantastic training. So we'll give them some room, to take a little off the top. But I mean, it is nowhere near the level of greed that you see in United Healthcare. I mean, that is crazy.
Well, we had Terry on last week.
Yeah. And your co-executive producer, Terry, on the other day, and he, like, Matt and I just kind of sat there with our jaws open. We weren't ignorant to this, but when you hear the actual numbers, it is nothing short of the worst kind of abuse.
He said that the bottom line
are piled up because of these practices. They're worse than any cartel.
Yeah.
The bottom line revenue, he said, of the health insurance industry is about 40%.
Yeah.
I've owned a business for
insurance
27 years, and I'll tell you what, if I had a 40% bottom line, I'd be fucking the happiest dude
out of
ever.
your
but
mind.
That is not the reality of business. Nobody has a fucking 40% bottom line. Now, keep in mind, it sounds like that's like after expenses have been paid. Like that's like what we are.
That's just money sitting there.
That's free money.
Right.
That's their free money.
That's after salaries.
And they've gotten so used to that after Brian Thompson was murdered, they had a bad quarter. Which
he fell on those bullets.
After he fell on those bullets, it wasn't good for business for a little while. So their next quarter, which ended up being Q1 of 2024, when that came about, they actually did well. They just didn't do as well as projected. Do you know what their shareholders did? Their shareholders sued them for not meeting their projections.
Wow.
Knowing, and even in the document says, we acknowledge they weren't as what was the word? But they weren't as ruthless as they had said they would be.
Would a group of shareholders be considered one person?
Where's our money?
Yeah, we don't care that your CEO
we don't care that people died and you just lost your head.
We want this is our golden goose, and we want our golden goose. They did not care. It was crazy.
That is bananas.
That's how this system is working.
And yet hyper predictable. If I'm being honest, you telling me that story, it doesn't surprise me.
I was getting a beard trim. I don't think it was long enough ago that I actually had hair. So it probably wasn't a haircut. And there's an older gentleman sitting next to me, and I forgot which war it was, which thing we got involved in. And this old motherfucker is like, oh, I guess I'm so happy I have, like, he listed like 3 military stocks. And I'm like, you fucking piece of shit.
Yeah.
like you're cheering for people to die. What a fucking piece of shit. And I said that under my breath, and the barber's like, look, you can't talk to an old dude. Like they're fucking. Yeah. And I'm like, look, I'll help him out the front door. Like, come on, you fucking piece of shit.
Literally warmongering. That's
So Sorry. I could talk to you about this all month, but I want to before we get out of here,
we're doing a thing, MaryAnn.
Yeah.
We gotta have
we gotta talk about the thing, right?
We got a thing. Coming up.
So you're a producer on Suck It Up, Buttercup. We've talked about it a million times here, but you do some talking.
Me ranting.
Yeah.
We actually have a project that really does need to be seen and heard by the people. Americans want to know. And so, as much as we've joked about murder, let's all agree murder is wrong.
Sure.
Murder is not the answer. And America is angry and they need help channeling that anger. Murder's not the answer. So what is?
I feel like she's saying that right to me.
Yeah. Tom, it doesn't matter if they're counted as one person or 20.
I'm Catholic. I can go and confess, right?
I appreciate your passion. I feel it too. We need to channel our energy to the correct answer. And the correct answer is we need an activated, educated population who's ready to vote, because we need to make changes in our country. We need an actual democracy. And then we can put legislation in place that protects patients. It might, and I don't get overly prescriptive, on what healthcare system we choose to put in place, but it should serve patients.
Sure.
And so if it does end up being a capitalistic system, it has to be true capitalism. Informed consumers, people can vote with their feet, transparent pricing, antitrust regulation. So, but what we need first is an activated and informed population. So if you think US healthcare is perfect the way it is, then this film's not for you.
Right.
But if you think maybe we could do better and you want to know what's wrong and how to fix it, then check out this movie.
Right. And
the website.
We are going to have a bunch of ways to get in touch with this movie, obviously, because we're also involved on the hosting of this event. So like we're all sort of like vested interest in this kind of thing. And I think one of the reasons we drew to it was everybody, hundreds of guests on this show, one way or the other, are talking about a similar version of the same thing. It's coming at it from different angles, from different viewpoints, from different everythings. But this is not a secret problem anymore. And I think the more I talk to people like yourself, the more I'm like, wow, it's less of a secret than I even thought, right? Like it's
the curtain's been drawn back for a while now. Yeah.
No, but Americans need to know where to channel that energy. And it really is time, because if you think about it, in our country right now, we agree on nothing.
No, right? Yeah, exactly, which is not helping.
Actually, we all agree on this. When you watch that congressional hearing back, where they like lined up all of the health insurance CEOs, we had senators and Congress people on both sides, basically all in agreement. It was amazing. So this is actually one thing right now that Americans can agree on. And I think there's value in that, regardless of what the subject is.
Right.
Let's start there. Let's just care for each other.
Yeah. And we joked a little bit with Terry, but I said, listen, if they're really taking 40% EBITDA on these companies, right? If you cut healthcare by 45%,
Matt, they're not paying taxes either, so it's not really EBITDA.
Yeah, right. So, but what I'm saying is, like, you could cut 25% out of healthcare day one. And all that does is adjust their margins to what every other company in the United States basically makes, right? You know what I mean? Like, and you would doing nothing, like no systemic change,
and still be a very successful
company, right?
And
very
very successful. What do we do with that money? Because remember, most of that money is for the biggest payer is actually the federal government. Those are our tax dollars.
Those are our taxes. Yeah.
So what do you want to do? Education, defense,
right.
Like, imagine what we could do as a country.
Yeah. And the funny part about that is
lining the pockets of incredibly wealthy people.
Sure. You know what's even funny about that? You're saying that. I'm like, hey, you want to build a fucking wall and you want to know how to pay for it? Well, here you go, dude. Like,
even the shitty ideas could be funded.
Even the shitty ideas could be funded, right?
Money to fund shitty ideas and good ones, all of them.
Yeah, no, that's my point. It's like, you bitch and moan about, well, why isn't anybody giving me money to build this wall? Well, it's a dumb idea. But if you wanted to pay for it, here you go. There's the fucking, here's a way.
There's the pile of money under the rug. Totally. So like, let's drive this home. Suck it up, Buttercup. Senator Theater here in Baltimore, March 19th. Come hang out with Dr. MaryAnn and the other producers of this. And, maybe give a little more and come get some drinks with us afterwards.
Yeah, it's going to be fun. Yeah.
Baltimore, Maryland, Senator Theater, March 19th, 7 p.m. Tickets are available through our website, www.suckitupbuttercupfilm.com. irreverenthealth.com. General admission is $25, but if you want to come across the street and have wine with the cast and crew afterwards, then you can access VIP tickets, and we hope everybody will come out.
Yes, indeed. All right, guys. Enjoy the weekend, MaryAnn. It was great talking to you, and I can't wait to see you at the movie.
Same.
All right, guys. Take care.
All right,
Bye.
take care.
Bye.
Be subversive, irreverent.
Health is wealth, but you knew that.
Everybody knows that.
But so is following us on social media at Irreverent Health. And check out our website for more exclusive content at irreverenthealth.com.
Oh, I like this.
Thanks for tuning into this episode of Irreverent Health.